Department of Community of Medicine, Nagaland Institute of Medical Sciences and Research organized a weekly health Mela at CHC, Medziphema on 29 September. The health Mela was visited by Joint Secretary, Ministry of Health and Family Welfare, Government of India and Nodal Officer of Ayushman Bhava campaign for the state of Arunachal Pradesh and Nagaland. Rajiv Manjhi, along with Chief Medical Officer, Dimapur, Dr. Limatullah Iyer, Joint Secretary and Nodal Officer Rajiv Manjhi said that the purpose of visit was to ensure that the people of the country are getting all the health benefits. And he also stated Nagaland is one of the least pledged organ donor state among the country and encouraged to donate organs. During the program, CMO Dimapur Dr. Limatullah Iyer informed that there is an acute shortage of specialist doctor for opioid treatment and also said that in regard to Ayushman beneficiaries, the sanitation workers belonging to non-indigenous people in the state are finding it difficult to obtain it and requested to look into the matter.
Welcome to Nagaland, first and foremost. We've been told this is his first visit to Nagaland, so we hope he'll have a very interesting time, a very interactive time with all who are here, and that all that you have been thinking to achieve, you will find them here in Nagaland. Today is his first day of visitation. He'll be here till tomorrow. Today will be Chumugudima district, tomorrow will be Kohima district, and I think we'll be having more interactions with him as the day goes by. As already emphasized about the Ayushman card, that it's everybody's right to have an Ayushman card. And so I know Chumugudima is doing well there, and just to encourage again further that all those who have missed out or who have not been able to generate, that we should be able to give all, the center should be able to give all assistance to make sure that the cards are generated and the ABBA numbers are also issued along with it. We do have issues where Ayushman cards are, for Ayushman beneficiaries are concerned. We have a lot, it's a mixed population. So for the indigenous people of Nagaland, we've got the CMHIS to take care of it as of now. But for those who are non-indigenous but who have been residing in Nagaland for the last many years, we are having problems generating their cards because their names have not been put in the socioeconomic census of 2011. And so, sir, on that note, I would also like to highlight that point. 100% is not achievable because of those issues that are there. If that can be taken up at the ministry, then I think we would be able to give more, because we've got a lot of especially sanitation workers who are there in the municipals that are without the card. We're not unable to give them cards because of this, which is very sad actually, because they are there working day in, day out, especially and then we're now into the swatch, and so everything included, but we're unable to help them out where this is concerned. And so if that issue can be taken up, then I think we will be able to they will be able to benefit, because this is especially in Dimapur area, we're having and all the other districts as well. This issue is there, and so that is one problem where Ayushman is concerned, and the inability for us to generate cards for them. Other than that, we've got network issues which has already been put up, so we do have problems. Many of, I think it has to be live on lifetime, and then on top of that, if the network is not there, then even now I think this recent drive that is going on, we are facing those problems in generating cards because the network issues are there and they are unable to, and so they'll have our operators have to go back 2-3 times to the village, but every time they go, that same problem is there. So these issues are there, and we are unable to fix that or come to some sort of find some solution for that. And so that's where Ayushman is concerned. I think for the multi-specialty Mela, health Mela that is ongoing right now here at Medziphema, I would also like to thank all the NIMSAR doctors who have come to help us out. We do have a shortage of manpower in our, at least where our medical fraternity is concerned, especially where specialists are concerned. So these issues are there. We are unable to provide all the specialty that's required. Now for the OT facilities to be given, we need an anesthetist. We also need surgeons, ENT, eye. We have a huge shortage of those specialists. So we are unable to activate our operating OTs to the maximum that we would like to, and then the services we would like to provide to the citizens. So likewise, they have to come either to Dimapur or go up to Kohima or things like that for specialized surgeries. And so minor surgeries, I think, are being taken up even by our medical officers, but then if it is a complicated, it's a bit more specialized, then they will have to go, and then that's where problems do come up, because it does require a lot of financial strain on the families, and many of them are unable to provide that for their own. So even the Ayushman card, even the packages are not enough to cover all those, and so it's discouraging for us. Also, we would like to help, but then sometimes our hands are tied where that is concerned. But then just on that short note, I think the patients are waiting outside also, and so those are the major issues that we have as of now in our districts. And so with those few words, thank you to all. And I think it's a very successful camp. We've got everyone, all the programs are here, so I think so you'll have a good time. Thank you.
Yeah, the purpose of visit is to ensure that common people of the country are getting health benefits. Government is providing Ayushman card for the needy people, and they must get. So the idea is during this campaign to saturate creation of Ayushman card. And the second is Abha card generation. So we are also striving to ensure that all Abha cards are generated. Along with that, the purpose of the visit is to see the health facilities in our country everywhere. It is developed properly. People are getting proper benefits of the facilities, health facilities that country has created. So an NCD screening in health melas, people are being encouraged to come forward, get themselves screened, checked for any ailment if they have. So that's the idea. That's the purpose of the visit. Yeah, it's a good question that we must organize some kind of awareness campaign so as to make people understand with regard to organ donations. We also need for organ donations proper facilities to transplant the organ, to preserve the organs. So that is also being considered simultaneously. We are also concerned about some of the diseases which are, being reported of late in this state. So that is also the idea. That's why I was interacting with my doctor fraternity, my doctor friends, that please tell us what is the number of patients, those who are reporting for leprosy. It's a new disease that's getting reported in the state of Nagaland.